I'm very, very pleased to have a renowned expert in melanoma treatment with me today, Dr. Paolo Ascierto. He is a leading expert in the National Tumor Institute in Naples, Italy. And I think he's at the front line, continuing to treat his patients. But he was also very active due to the situation in Italy in really working also on COVID-19. So Paolo, it's a big pleasure to have you here. I'm curious to hear, Italy was hit very hard, but I know you don't let your patients down. So how did you manage the situation? Did you change your treatment protocols? Tell me a little bit how you are managing to continue treating your patients.
Hi, first of all, it's also my pleasure to be here today with you to discuss about what we did during this COVID-19 crisis. So what we did is, as first, the most important rule that we followed was to keep everybody safe. What does it mean to keep everybody safe? It means to keep safe patients as first, but also physicians, nurses, so the health workers, because as you probably knew, the infection among the health workers was one of the most important causes of the diffusion of the infection. So what we did is to take some important action there to avoid the risk of infection among patients and health workers. So we try to avoid the gathering. We used triage in order to optimize the access of our patients. Of course, we used also DPI, but the most important things was to prioritize the access of the patients. And what does it mean to prioritize the access? Of course, we prioritize the patients with a higher risk, and for this reason, the metastatic patients were considered the highest priority, because nothing will change because their condition, because as you said, for this kind of patients, we have important treatments that we cannot delay anything for this. So for this reason, nothing changed for metastatic patients. For the other situation, we did some action in order still to avoid the gathering, because in the waiting room, if we consider an access of a high number of patients, this may increase the risk of infection. Looking to the surgery, we give a high priority for the patients with deep melanoma. While for these patients, because it's also important, the staging, we performed the central lymph node before the others. We postponed the patients with early melanoma, like in situ melanoma or the PT1 or the T1, T2. But for the patients with palpable disease, the patients who needed and who need of treatment for all metastatic disease, we didn't postpone the surgical treatment. For the follow-up, we organized ourselves, our ambulatory with the telemedicine. So we contacted the patients. A medical oncology each day was in contact with our patients. He or she received the exams that we asked to the patients, read together the patients the report, and then if no evidence of this, if no problem, we booked the patients for another control. In case of evidence of problems, we asked the patients to come in our institution for better evaluation of a clinical evaluation. For the adjuvant treatments, we try to avoid any gathering in the waiting room and in the hospital seats. We used all the 12 weeks for starting the treatment. We optimize the access. In case of patients with BRAF wild type, we preferred the longer schedule still to avoid the gathering. This is exactly what we did also for the metastatic disease. For the BRAF mutated patients, we prefer the BRAF MEK inhibitor, because our tablets the patients can assume at home, and of course still with these optimizings, we had less patients in our the hospital. Two additional important points. One was about clinical trial, because mainly for the phase 1, several clinical trial was on hold for the enrollment, and the patients who were already enrolled continued the treatment. But together, the medical monitor, of course, we tried to keep the patients safe, and also to use the telemedicine sometimes, but all in the respect of the good clinical practice. There were two important conditions of side effect that was important. So a special warning for the pneumonitis due to checkpoint inhibitor, and the fever due to BRAF/MEK inhibitor. You know that pneumonitis is one of the most important side effects from the checkpoint inhibitors, and for this reason, in cases of pneumonitis, we asked to these patients to perform nasal swab in order to be sure that there was no COVID-19 condition. The same for the patients in treatment with BRAF/MEK inhibitor in case of the fever that was not resolved after the interruption of the treatment. Again, in order to be sure that no COVID-19 condition was in these patients, we still asked, and we're asking nasal swab. So in general, this is a summary about what we did for our patients. Of course, we consider the priority, and for this reason, the high-risk patients preferred were given high priority, but we continue our daily activity, of course, consider also the condition of the COVID-19.
And when you look now at the situation, it has stabilized, thanks God, and we see that also Italy is really getting it under control. When you look now forward, what are your concerns? What you're concerned about? Also, any advice you would give to patients, as it's not completely over, and we still have to stay careful.
Absolutely, because the concern is for a second wave at the moment, at least looking to the intensive care unit and also the infection disease unit. It seems that the things are really going better, but of course the virus is still among us, so it's really important to make attention, and more for the patients, of course, because this is an important moment, because there are now again some activity that restarted, and for this reason, more people are at the moment in the roads, in the streets, and it's important, of course, to take these kinds, the mask, to make attention about the hands, so washing frequently, so all the things that we did during the lockdown.
So you really recommend to patients they have to be careful, and they should probably consider when they go out, or don't you think it's necessary?
No, I believe that is so. This is a particular phase, as I already told. So it's important for all of us, so patients and also for us as health workers, to make attention in order to avoid an infection, because the most important problem at the moment is to reduce the possibility of an infection, because the second wave is our big concern.
Dr. Ascierto, thank you so much for being with us and sharing how you approach treatment. I mean, what I clearly heard, you prioritize and you go really by severity and advanced stage of the disease. I think what I also heard, you really tell all of us to stay careful and listen and respect the rules that are in place, and also give this advice to patients. So really appreciate, thank you for all you do for patients in these days. It was a pleasure to speak with you.
It was my pleasure.